Hi guys, it's your learning desire. So today we are going to talk about RH incompatibility. So first of all, we will start from the RH factor. What is RH factor? It is a specific protein which founds on some RBCs, and not everyone carry this protein. A person who carry this protein is RH positive, and person who doesn't carry this protein is RH negative. Basically, RH factor has no effect on general health, but it can cause serious problems during pregnancy. Definition: RH incompatibility is a condition when a woman and her unborn baby carry different rhesus protein factors. This is called as RH incompatibility. Now, this occurs when a woman is RH negative and her baby is RH positive. Rh disease is also known as rhesus isoimmunization, and it is a type of hemolytic disease of the newborn. Rh type and pregnancy. If a pregnant woman and her husband are Rh negative, then there is no need to worry. It means that there is no need to worry about Rh incompatibility. Second one is, if a mother is Rh negative and her husband is Rh positive, then there may be chances to develop Rh incompatibility. Why? Because it will inherit to the baby through the father's blood type, which create incompatibility between mother and the fetus. Next is, if some of the fetal blood gets into the mother's bloodstream, her body will produce antibodies, and these antibodies could pass back through the placenta, and it can harm the baby's developing RBCs, and then this cause mild to severe anemia, and which is sometimes very fatal condition is for fetus or for baby. Now, why it occurs? What are the causes of RH incompatibility? First of all, RH incompatibility occurs when there is a difference in the blood type between a pregnant woman and in her baby. Now, what are the risk factors? If a woman is Rh negative, but she exposed to the Rh positive blood before the pregnancy, then there is a chances to develop a Rh incompatibility problems. This may happen during when there is a mismatched blood transfusion and bone marrow stem cell transplant. It means that if she exposed with mismatched blood transfusion and bone marrow stem cell transplant. Second one is an injection or any needle which punctures or other object which containing Rh positive blood, then it means that there are chances to develop Rh incompatibility. Next one is, certain test can exposure to Rh positive blood, for example amino synthesis plus chorionic villus sampling. Next one is, a previous birth with an Rh positive baby, then there are chances to develop Rh incompatibility. Screening and prevention. Now we can prevent Rh incompatibility by giving Rh immunoglobulin at correct time. If the Rh antibodies have been formed, then this medicine will no longer work. Next is, if we do early detection of Rh incompatibility, then we can prevent it. Now, what are the signs and symptoms? As Rh incompatibility affects the unborn baby, then few symptoms can appear. For example, first one is the low muscle tone, lethargy, jaundice, hemolytic anemia in baby. Now, what is hemolytic anemia in baby? It is a condition in which RBCs are destroyed faster than the body can replace them. Next one is the higher bilirubin level. Now, why it is occurring? It is occurring due to the death of RBCs. Also, it can lead to brain damage in the baby. Next one is, severe hemolytic anemia can be fatal to a newborn. So these are the main signs and symptoms of Rh incompatibility. What are the diagnoses for RH incompatibility? There are certain tests which can identify the RH incompatibility. First one is the blood test, which are used to determine RH status. Next one is the Coombs test, and if it is negative at 12th week, then it will repeat at 28th week plus 36th week in primary gravida, and in multigravida test to be repeat at monthly interval from 24 weeks onwards, and if it is positive then patient should be supervised. Now next one is the quantitatively albumin antibody is done at weekly interval. Next one is fetal ultrasound, fetal blood typing, how it occurs. We can do it from amniocentesis or maternal circulation. Next one is a direct assessment of fetal anemia, in which we assess the fetal HB and hematocrit value. And last is Rosette test. Now, what are the treatment for RH incompatibility? It can treat with a medicine which is called as RH immunoglobulin, and also we can see that in a clinical practices there are patients who are having RH incompatibility. They are providing anti-D injection. So in this case we can give a anti-D injection. Phototherapy we can give to a newborn so that we can treat jaundice. And if RH incompatibility diagnosed, the mother will receive RH immunoglobulin in the 7th month of pregnancy and again within 72 hours of delivery. In severe cases, blood transfusion are done through umbilical cord. So this is all about the RH incompatibility, and this is the most important topic. And when I ran away, you're all that I could see when I could